Levalbuterol, also known as Xopenex Vial for Nebulizer, is used to treat wheezing and shortness of breath that often happen with lung problems like asthma or chronic obstructive pulmonary disease. This medication is considered a quick relief drug and can help decrease the time lost from work or school by controlling these symptoms. Levalbuterol belongs to a class of drugs called bronchodilators, which work by relaxing the muscles around the airways, allowing them to open up and making it easier for you to breathe. It is important to follow the dosage instructions provided by your doctor or pharmacist. The best time to take this medication is typically when you experience symptoms of wheezing or shortness of breath. Before using Xopenex Vial for Nebulizer, make sure to read the patient information leaflet from your pharmacist. This medication is used with a nebulizer machine, which turns the solution into a fine mist for you to breathe in. It's important to consult your doctor, pharmacist, or respiratory therapist to learn the proper way to inhale this medication with the nebulizer. When using this product, it should be clear and colorless. Always check for particles or discoloration before use, and if you see either, do not use the liquid. Xopenex Vial for Nebulizer does not need to be mixed before use unless your doctor tells you otherwise. Your doctor will likely instruct you to use this medication 3 times a day, with each treatment taking about 5 to 15 minutes. It's important to only use this medication through a nebulizer and to not swallow or inject the solution. Also, do not mix it with other medications in the nebulizer. To prevent infections, be sure to clean the nebulizer and mouthpiece/face mask according to the manufacturer's directions. The dosage of Xopenex Vial for Nebulizer is based on your medical condition, age, and response to treatment. Do not increase your dose or use this drug more often than prescribed without your doctor's approval, as doing so can increase your risk of serious side effects. It's also important to learn which inhalers/medications you should use every day, controller drugs, and which you should use if your breathing suddenly worsens, quick relief drugs. Ask your doctor in advance what to do if you have new or worsening cough or shortness of breath, wheezing, increased sputum, worsening peak flow meter readings, or if you use your quick relief inhaler/medication more often than usual. Also, learn when you can treat sudden breathing problems by yourself and when you must seek medical help right away. Lastly, be sure to tell your doctor if your symptoms do not improve or if they worsen. Some possible side effects of using Xopenex Vial for Nebulizer include headache, nervousness, shaking, dizziness, trouble sleeping, dry mouth, nausea, stomach upset, diarrhea, or runny nose. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Xopenex Vial for Nebulizer may raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as fast or pounding heartbeat, anxiety, or swollen glands. Seek medical help right away if you have very serious side effects, including irregular heartbeat, chest pain, rapid breathing, or confusion. Although rare, this medication can cause severe, sudden worsening of breathing problems or asthma. If you experience sudden wheezing, seek medical help immediately. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using Xopenex Vial for Nebulizer, it's important to talk to your doctor or pharmacist if you have any allergies to levalbuterol, similar bronchodilators, or sympathomimetic drugs. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's crucial to discuss this with your pharmacist. You should also inform your doctor or pharmacist about your medical history, especially if you have heart disease, high blood pressure, seizures, or diabetes. Xopenex Vial for Nebulizer may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xopenex Vial for nebulizer should only be used when clearly needed. It's essential to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Xopenex Vial for nebulizer, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that Levalbuterol, the active ingredient in Xopenex, is very similar to albuterol. Therefore, it's crucial not to use inhaled medications containing albuterol while using Levalbuterol. As for the best time to take Xopenex Vial for nebulizer, it's essential to follow your doctor's instructions regarding the dosage and frequency of use. This medication is typically used to treat breathing problems such as asthma or chronic obstructive pulmonary disease, COPD. Be sure to use it exactly as prescribed by your doctor for the best results. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of overdose may include chest pain, fast/pounding/irregular heartbeat, headache, shaking, tremors, nervousness, weakness, severe dizziness, and seizures. It's important not to share Xopenex Vial for nebulizer with others. It's also recommended to avoid allergens, irritants, smoking, and other factors that can worsen asthma symptoms. Your doctor may want to conduct lab or medical tests, such as checking your blood pressure, heart rate, or EKG, while you are using this medication. It's essential to keep all your medical and lab appointments and consult your doctor for more details. It's a good idea to learn how to use a peak flow meter and use it daily. If you notice any worsening of your asthma symptoms, such as readings in the yellow or red range on the meter or an increased use of quick-relief inhalers, it's important to promptly report these changes to your doctor. If you forget to take a dose of Xopenex Vial for nebulizer, take it as soon as you remember. However, if it is close to the time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When using Xopenex Vial for nebulizer, it's important to store the vials in the foil pouch at room temperature, away from light and heat. Make sure not to store them in the bathroom. Once the foil pouch is opened, use the vials within 2 weeks. If the vials are removed from the foil pouch, use them right away or protect them from light and use within 1 week. Remember to keep all medications away from children and pets. It's essential to properly dispose of the product and it is expired or no longer needed. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to discard the product. Xopenex Vial for nebulizer is used to treat conditions such as asthma and chronic obstructive pulmonary disease, COPD. It works by relaxing the muscles in the airways and making it easier to breathe. The usual dosage for adults is 0.63 mg to 1.25 mg used 3 times a day, with each dose separated by at least 6 hours. The best time to take this medication is as prescribed by your doctor, and it's important to follow their instructions carefully. Remember to consult your doctor for the correct dosage and timing of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.